So most of the evidence that we have looking at these factors in breast cancer really focuses on how they relate to breast cancer risk. So there are now thousands of studies that show that women who are heavier after menopause have a higher risk of developing breast cancer. There are also data that suggest that women who exercise more have a lower risk of developing breast cancer. The dietary factors are not as consistent. There is clearly an increased risk of breast cancer in women who consume higher levels of alcohol, but there's not as much evidence linking specific dietary foods or dietary patterns to the risk of developing breast cancer. There's also a lot of evidence that shows that these factors continue to influence outcomes after someone has developed an early stage, potentially curable breast cancer. There are studies that show that women who are obese when they're diagnosed with breast cancer have a 30 to 40% higher risk of dying from breast cancer or other causes compared to women who are of lower body weight. There's also emerging data showing that physical activity may be protective after breast cancer diagnosis, and that women who exercise regularly seem to have a lower risk of cancer recurrence. These are mostly not randomized trials, so we don't have the same level of evidence that we do for, say, tamoxifen or an aromatase inhibitor. But the associations are pretty consistent, and so there are studies now going on trying to test whether if you help somebody make these changes, exercising more, lowering their body weight, whether that will actually reduce their risk of recurrence.